My name is Corbin J Standley. I'm a PhD student at Michigan State University here in the United States. I'll be talking about my research looking at intersectionality, social support, and suicide risk among youth. So I'm excited to present these findings to you. So to get started, I'm going to go over some terminology and things, but I also want to mention sort of the outline of the presentation that I'll be going through today. So I'll first talk about the scope of the issue of youth suicide, both globally and in the United States, and provide some context for this particular project. I'll then talk about the methods and the sample I used very briefly, and spend the majority of the time talking about the analysis and results from this study. I'll then talk about some of the implications for these findings and how they can expand research policy and practice moving forward. So to provide some context regarding youth suicide, I first want to define the terms that I'll be using in this presentation. As many of you know, intersectionality looks at how systems of power and oppression manifest at the individual level of experience on the basis of identity, social identity, as well as the intersections of those identities. So, for example, in this particular study, I looked at the intersections of gender identity, sexual identity, and race and ethnicity. And so intersectionality is about the intersection of those identities, as well as how systems of power and oppression influence experiences of intersectionality. I also used a socio-ecological framework, and this is sort of a tool that allows us to explore factors at multiple levels. And in this particular study, I looked at family, school, and community levels of social support as experienced by youth. I also want to talk specifically about some of the terminology I'll be using around suicide. So suicidality is the sort of dependent variable that was used in the study. And suicidality consists of suicidal ideation, suicidal behaviors, and suicide attempts. So suicidal ideation are the thoughts of engaging in suicide-related behavior that a person might experience. Behaviors are those behaviors related to suicide, including the preparatory acts, as well as suicide attempts and suicide death. A suicide attempt is a non-fatal, self-directed, injurious behavior that's enacted with the explicit intent to die as a result of that behavior. Suicide is the death caused by those self-injurious behaviors, again, with that explicit intent to die as a result of the behavior. And suicidology is the empirical study of suicide, suicidal ideation, and suicidal behavior. So this is the field of study related to suicide. Suicide data is something I want to specifically talk about in the larger context. We know that over 800,000 people die by suicide each year, according to the World Health Organization, and that this number is likely underreported for a number of reasons, including data reporting processes in certain countries, a failure or reluctance for family members and others to disclose suicide as a cause of death, for example. And based on these numbers, since I started speaking today, 4 people somewhere in the world have taken their own lives by suicide. We also know that suicide is the second leading cause of death among youth and young adults ages 15 to 24 in the United States and in the state of Michigan. And we know that suicidal ideation and suicide attempts are the most commonly reported mental health crises among youth in the United States. So to provide some context for this study, I've been in partnership with the Tri-County Lifesavers Suicide Prevention Coalition here in mid-Michigan for about 3 years now. This is a coalition of public and private partners, including educators, mental health professionals, parents, providers, legislators, all coming together with the goal to prevent suicide. And so this partnership has involved a number of things, including data collection, strategic planning, and event collaboration. So for the sake of time, I'm just going to go through this part really quickly, but this is largely the socio-ecological model that was used in the study, and I wanted to examine social support at all of these levels to figure out how social support can mitigate the impacts of marginalization on youth suicide. And so there were 4 major questions that guided the study. Who reports the highest suicidality scores? To what extent is the presence of social support associated with lower suicidality scores? To what extent are compounding sources of social support, so family, school, and community together, associated with lower suicidality? And to what extent does social support moderate the association between intersectionality and suicidality? So the conceptual model for this study, I was interested in how intersectionality, particularly marginalization of intersectional identities, contributes to suicidality among youth, suicidality being suicide ideation, suicide plan, and previous suicide attempts, as well as the role of protective factors, namely social support at the family, school, and community level in and its association with lower suicidality scores. And I was also interested in the moderating effect of social support on the relationship between intersectionality and suicidality among youth. So this study involved secondary data analysis from the 2015-2016 wave of the Michigan Profile for Healthy Youth survey. And so this is a biannual survey administered in middle schools and high schools in the state of Michigan. And so the sample consists of just over 5,000 high school students in 3 counties in mid-Michigan. And the sample, the demographics for which are presented here, are relatively evenly split by gender and are representative of the racial composition of mid-Michigan. So the intent was not to generalize to other populations. So I'll very briefly go over some of the scales and measures that were used in the study. First, identity was measured by using the demographic variables included in the study, including gender, race and ethnicity, and sexual identity. I'll address this in the limitation section, but it's worth noting that gender was dichotomous on the MyFi survey, and that's something we're working to change with the state legislature. Intersectionality was measured by creating an additive score of the 3 demographic variables. So the 3 demographic variables were dummy coded as 1 being minority status, 2 being majority status, resulting in an intersectionality score ranging from 0 to 3 for each case. Suicidality was measured using an additive score of suicidal ideation, having expressed suicidal thoughts in the previous year, planned suicide attempt, having made a plan to attempt suicide in the previous year, and previous suicide attempts. So having actually made an attempt to end one's life in the previous year. And so again, this resulted in a composite score ranging from 0 to 3 for each case. And social support was measured using a number of items at the family, school, and community levels, measuring opportunities and rewards for pro-social involvement. And you'll see the citation here on the bottom of the screen. This is a paper. This study is going to be published in Suicide and Life-Threatening Behavior Journal. And so that is currently in press, and I'll include some links and references at the end of the presentation. So to talk about the analysis and results, there were 3 major phases of analysis that were used. First, means comparison t-tests were used, followed by standard linear regression and hierarchical linear regression to address the 4 research questions I described earlier. And so the first research question, who reports the highest suicidality scores? What we found is that gender, race and ethnicity, and sexual identity were all significantly associated with suicidality. And in particular, as you can see by the effect sizes, sexual identity was most strongly related to suicidality scores, and that those who reported, those with marginalized identities in any of these categories were significantly more likely to report higher suicidality scores than their peers. And the more marginalized identities a respondent had, the more likely they were to report higher suicidality scores. And as you can see, as I mentioned, sexual identity was the most strongly related, followed by gender and race and ethnicity, respectively. The second question I was interested in was how social support might reduce suicidality, or rather be associated with lower levels of suicidality, given that this is a cross-sectional study. So what we found was that intersectionality was related to suicidality and was included in the first block to account for these differences. And we found that family support, school support, and community support were all significantly associated with lower suicidality scores. And so family, school, and community support were all associated with these scores, but the effect sizes show that the more proximal sources of social support were actually more strongly related to lower suicidality scores. So family, followed by school, followed by community, respectively. I was also interested in examining the extent to which compounding sources of social support contribute to suicidality. So this was assessed using a hierarchical regression model. And what I found was that the combination of family and school support was most strongly associated with lower suicidality scores. So this was a higher effect size than family support on its own or school support on its own, but the combination of both actually resulted or was associated with lower suicidality scores. And family support explained the most variance in that model, as you might guess. Finally, I was interested in how social support might moderate the relationship or the impact of intersectionality on suicidality. So this is sort of that conceptual diagram I presented earlier. And using the process macro for SPSS developed by Hayes, this is sort of the statistical relationship and that I was interested in examining. And so the figure on the right shows that the conditional effect of intersectionality on suicidality is the sum of the main effect of intersectionality plus the product of the interaction between social support and intersectionality. So this B3 is sort of the coefficient I was interested in to determine if there was a moderating relationship of social support on this relationship between intersectionality and suicidality. And so what I found was that for family support, the interaction between intersectionality and family support was statistically significant. And so simple slopes analyses were conducted to understand the interaction finding for family support. So the effect of intersectionality was estimated separately for high and low levels of family support. And analyses confirm a moderated relationship such that at low levels of family support, the simple slope for intersectionality was 0.58. And at high levels, the slope was 0.28. So the greater presence of family support weakened the relationship between intersectionality and suicidality. And so these findings supported our hypothesis in that higher intersectionality scores were associated with higher suicidality at each level of family support, but the effect was smaller with higher levels of social support. So this sort of interaction here, as you can see, these two would converge at some point, and that lets us know that family support does indeed moderate the relationship in this particular sample. We did not find a significant interaction term for school support or community support, and so we did not follow up with simple slopes analyses for these particular for school support or community support. So to kind of sum up that last piece, we found that family support moderates the relationship between intersectionality and suicidality, that higher intersectionality scores were associated with higher suicidality scores at each level of family support, but that the magnitude of that effect was smaller with higher levels of family support. And there was no moderation effect found for school or community support. And what this suggests is that family support might actually be more impactful for those with marginalized identities. So to talk about some of the implications of these findings, I'll just summarize my results quickly. Youth with intersecting marginalized identities reported significantly higher suicidality scores. The more marginalized identities youth have, the higher the suicidality scores that they report. Social support at the family, school, and community levels is significantly associated with lower suicidality. The combination of family and school social support is significantly associated with the lowest suicidality scores. And social support and families significantly mitigated the impacts of multiple marginalized identities on suicidality. I'll also mention that in addition to the in-press paper I have with Penny Foster Fishman, I also published a paper in Death Studies earlier this year that outlines some of the theoretical components that I discussed here today, including intersectionality and socio-ecological models and their utility in suicide research. So there are some overarching implications from these findings. First, while per capita suicide rates for white Americans and indigenous people are higher than most other groups, when we begin to account for some of the intersectional disadvantage, some of these trends start to become less clear. To be most effective, social support should be bolstered across every context in which youth live, learn, and play. We saw that the compounding effects of family and school support were the most protective. And so extending this to bolster social support across contexts is important. And the more proximal sources of social support tended to have greater protective effects than the more distal sources. And again, social support might even be more important for those with intersecting marginalized identities. As with any research, there are some limitations. There were restricted and gender identity options. the dummy coding of identities could be an issue. This was a narrow application of intersectionality, and the cross-sectional and self-report nature of research is always a consideration, especially since we don't know the longitudinal effects of this research. Thank you so much for your time. And here are those references I mentioned. And please feel free to reach out to me if you have any additional thoughts.